Hi guys, let me tell you something about sciatica pain. Sciatica is one of the most common yet misunderstood types of pain. As many as 40% of people will get it during their lives, and it becomes more frequent as you age. Sciatica tends to get lumped with a regular back pain, but it is different. The pain usually originates with sciatic nerves and often goes away by itself within a few hours or day. However, some attacks can come and go for several weeks or even months. Fortunately, there is a lot you can do to prevent sciatica as well as to relieve this pain. So here are the 5 tips how you can control or cope with this kind of condition. Tip number 1, increase in exercise. Exercise is a key way to prevent or to help to relieve this condition, sciatica. Consider these types of exercises like aerobic exercises like walking, jogging, swimming, cycling, dancing, or other activities that increases your heart rate without causing more pain if you are already having sciatica. Okay. Number 2 will be strengthening exercises, like exercises using free weights or weight machines, or isometric exercises which involve contracting the muscles without obvious movements. Number 3 will be flexibility exercises like Pilates, yoga, or any other similar activities that increases both flexibility and strength. So any exercise that you can enjoy and do regularly is going to help. So try something new, go back to an old favorite, or both you can try. Another tip is avoiding prolonged sitting. Prolonged periods of sitting put pressure on the disc and ligaments in the low back. So if you have a job that requires a lot of sitting, so take frequent breaks or try a standing desk exercises, or take a walk for a few minutes. So less sitting is much better. Another tip will be managing your body weight. So if you are overweight or obese, it will increase your risk for sciatica, and people who are having sciatica and are overweight tend to heal more slowly. So the increased weight put pressure on your spine and can lead to herniated discs. Even minor weight loss will reduce the inflammation and pressure on the spine. So try to manage your body weight to avoid this type of problem.